Today has been named Omicron variant. So we're now joined via Zoom by Professor Adrian Puren, who's the acting National Executive Director of the National Institute for Communicable Diseases. Prof, thanks very much indeed for joining us, and welcome to the program.
Good evening, Peter. Thanks for the opportunity. Thank you. I just saw the breaking news there about Omicron, so thank you.
It's finally been named. It looks as if they've jumped a letter, though, haven't they?
It looks like it, yes.
Yeah.
Maybe there was something else in between. So.
But that's probably another whole story. But getting back to this one, it is being called a variant of concern. Why is it being described like that?
So the WHO has a classification system, and it's really based around what the virus actually looks like in terms of its potential, spread, in terms of the effects it will have, in terms of immune responses or responses to any drug or reagents and vaccines. So I think based on the various pieces of data that I think South Africa has certainly demonstrated in terms of very rapid rise in terms of cases, for example, as well as other laboratory-based data and epidemiological data, it's likely that this is the reason for it being declared a variant of concern. So the mutations that will affect the nature of this particular virus are multiple, and in particular affecting what we call the spike protein. And there are multiple mutations that are noted on this particular, the genome of this particular virus, that leads one to think that there may well be immune escape, for example, as well as the possibility of affecting transmissibility.
Minister Joe Phaahla was busy this evening trying to calm people and almost, calm the situation, as it were. He says that no indications yet that this is highly transmissible via a variant, or it might affect our vaccines. But that doesn't say we know enough to say that it doesn't, does it?
Absolutely. So I think it's really critical. I think there are indicators that's why I would assume that the WHO has called it a variant of concern rather than a variant of interest, because of these particular factors. In fact, as you know, the positivity rate has risen very dramatically in Gauteng. We're starting to see slight increases in hospitalizations. I know the other provinces have not been markedly affected. But yes, it is important that we realize that at this point, we need to have further information to really lead us to the conclusions that we have made, or certainly points to, in terms of really being a variant of concern, that in fact those changes are real in terms of increases in transmissibility, as well as not responding to the vaccine. But again, some of these factors will take a bit of time in terms of laboratory-based data. And again, laboratory-based data certainly tells you certain aspects. It's not the complete picture. And so you really have to combine that with the epidemiological data. And that the initial epidemiological data certainly shows the likelihood that this the changes that we're certainly seeing in Gauteng are possibly the result of a new lineage being present.
My understanding is that it's not so much the number of mutations, but rather the location of the mutations that's causing the concern. Help us understand what that means.
Yes, so as you know, since the onset of this particular pandemic, the virus has been evolving. So there's some very beautiful pictures that show the molecular genetic characterization of this particular virus through these past 2 years. And so multiple variants have been identified. And some of the changes really are what we call synonymous changes. In other words, it does not affect the virus in terms of its ability to evade immune responses, or in terms of vaccine efficacy, there are no effects. However, there are specific changes or key changes. And again, it's not just simply key changes, but maybe the combination of key changes that allow for this virus to mutate to the point where, for example, it becomes more highly transmissible and or is able to evade the immune responses. As you know, the vaccines, for example, have been directed, or several of the key vaccines have been directed against what we call the spike protein. So mutations in the spike protein are therefore of great interest, because certain of those specific changes affect how the body responds to the mutated virus, and or the vaccine responses will also be affected by that, affecting so-called vaccine efficacy. However, we've seen some major variants of concern that have been in circulation, but we have noted that in fact, although there may be certain declines in so-called vaccine efficacy, but overall, even though you may have an increase in infections or breakthrough infections, the protection against severe infections and hospitalizations still remain. And I think that is, the hold or the hope that we do have, that despite these multiple changes, that in fact there will still be a protection by the vaccine. And again, just to point out, you raised a very important point. We've seen the variant so-called C1.2 that's in circulation in South Africa. And again, that virus looks very different in terms of the mutations, and yet it hasn't actually taken off in South Africa. It's still about 5% in circulation. So I think we just need to be cautious, as you say. There are these multiple changes, and again, that's very unusual to see in these viruses. But so I think we just need to see what the science and the epidemiology shows us. Yes.
As scientists, how do you measure the potency of a variant? Do you wait until a certain number of people get sick, or are they testing in the laboratories? How do we get to an equation that says D is this, Omicron is this?
Yes, I think it's really looking at rates of infection, in other words. So Delta is a good example of the virus that when you look at rates of transmission and the numbers of cases over time, that you can really get a sense or an epidemiological sense of whether or not this particular virus is more transmissible. But that's the so-called epidemiological evidence. And again, there's obviously the laboratory-based evidence that looks at rates at which this particular virus will infect cells, or rates of infection, for example. That will give you some clues. There can also be animal experiments, again, to show how these viruses are transmitted and the rates of those particular transmission. The immune evasion, again, is also based around, and this is really key for South Africa. We have what is called the EVDS system, and this needs to be linked to other systems to give us an idea of breakthrough infections. I think that's really going to be important. Vaccine efficacy and or effectiveness is really the key here to show you, to demonstrate to one whether or not the vaccine has lost its ability to neutralize and prevent infection. So there are key epidemiological data that are going to be really critical for South Africa, as well as the rest of the world, as well as laboratory-based data to really demonstrate whether or not this virus has evaded our immune systems and resulted in poor vaccine efficacy. Nevertheless, my sense would be that we should encourage people to continue to vaccinate, regardless of what the current state of our knowledge is of this particular virus. Because my sense would be that there may still well be a certain degree of protection that we should encourage people to have the vaccine, especially to protect against severe disease. Yeah.
One gets a sense that South Africa is a victim of its own sophistication, because we have got quite advanced genome sequencing laboratories, and we can collect all this data. And a good number of other countries on the continent are not. And so we report, as the WHO has asked us to, but we get slapped with the ban. How possible is it that there could be a number of other variants in other parts of the continent that probably just are not getting reported?
Absolutely. I think, and it's not just on this particular continent, it's elsewhere. It depends on the nature and extent. I mean, I know the UK is also a very good example of a country that is really invested in terms of its molecular surveillance. I think the United States is again an example where there's unevenness around monitoring the actual variants. I think, yes, South Africa has really just been wonderful in that sense, that it has developed both a public and private network of laboratories that have actually been reporting on these variants. So I think it's really been critical, because it's a critical component of our surveillance system, is to really know what is in circulation. But you're right. Again, when you come back to the point about vaccination and really increasing the numbers of people that need to be vaccinated, there may well be areas in the world where that's going to be at a slower rate. Not to say that South Africa is doing terrifically well on that, but you're quite right. That if we don't have extensive molecular surveillance, that could be problematic. But again, South Africa, and this is through Africa CDC, WHO, and various other organizations, are really trying to provide support to various other countries